everyone can still hear and see me. I'm going to turn my camera down a little bit so you can see the demonstration. It should be really straightforward. It should be really simple here. Basically, you just need the three things: your drug, your syringe with the needle, and your penis. So first thing with the needle, you're going to take off this orange thing. This one is protecting the plunger, and this one is protecting the needle. I want you to see how small this needle is, relative to my finger. I've got pretty big fingers, so this is a tiny needle that really should not hurt. And then you take your medication, okay, and you want to hold it upside down so that the air goes to the top. Now, sometimes these vials come with a little metal seal over it that you just have to pop off. So then now you're looking at the metal with the rubber in the middle that you can puncture. And basically, what they'll recommend is that you load up your syringe with air to the dose that you want. Let's say it's 40 units or 0.4 cc's, and you'll basically puncture that little rubber spot. You can push some air into the vial. You don't really need to do that step, but it can just help make the aspiration a little bit easier. And then you just aspirate back. You can't really see clearly on this video, but some of the fluid from the vial is going into my syringe. Once I got the dose that I want, I'll just basically flick it to get some of the air out. Okay, you can then take it out. Now this vial doesn't leak when you take it out. You're done with this. I'll flick this to get any more air out. Might push it a little bit to get any last little air drops out. Okay, now I've got my dose that I want. And now here's the penis. So again, the urethra runs at the bottom and the nerves and blood vessels run along the top. So you're going to want to come along the side. You can cheat up a little bit towards the top. So the recommendation is between 1 and 3 o'clock. And you can do anywhere along the shaft on either side of the penis. You only have to inject one side. Those two corpora cavernosa are connected. You don't need to inject both sides. So you'll pick your spot, you'll clean it up, you'll let the medication dry, and then you'll basically put the needle into the side of the penis. Okay, you'll deliver the medication, just pushing the syringe here. Okay, you take the syringe out and you hold pressure. And this stuff works automatically. It's not like the Viagra where you need to have some sort of stimulation, to get the process going. You could be sitting here talking politics. If I inject your penis with this medication, it should go up. So it's very easy and straightforward. There's not a whole lot to it. We can demonstrate that again. Again, you take your needle, you puncture the vial with the medication. You can aspirate the dose that you want. Okay, let's say we're going to do 30 cc's here. Okay, disconnect. Get your air bubbles to go to the top of your syringe. Push the air out. Okay, take your medication, put it into the side here. Oh, your penis you cleaned it with the alcohol swab. You pick your area between 1 and 3 o'clock, where 12 o'clock is the top and 6 o'clock is the bottom. So just kind of along the side, push the needle all the way in, and then just push the medication in. Take the needle out, hold pressure for a minute or two, and you're done. So I don't know what else to talk about. Oh, I guess disposing. You don't need to recap your needle. Just throw it into your needle container, and that should be it. You put your medication back in the fridge, and just mark when you first punctured it. You got 28 days from then, or 60 days from when you first got the medication to use it. Thanks for watching. Please like, comment, and subscribe.